Okay, so let's get started. Thank you all for being here today. For those of you who don't know, my name is Stephanie Harvard. I'm the co-chair of the Lungs on Fire Knowledge Mobilization Working Group, which is the organizer of this speaker series. And Lungs on Fire, of course, is a 5-year team project that is led by Dr. Chris Carlston in collaboration with investigators across many different sites. It's funded by the Canadian Institutes of Health Research. And really, the goal is to better understand the health harms of wildfire smoke and to think about how we can optimize health guidance in the context of sort of increasing wildfires and threat of wildfires. So, one really important thing that, of course, we want to do is advance discussion around the effectiveness of different potential interventions that we might use and what considerations should we address before recommending those interventions to people in different sort of unique contexts. So this is the second installment of the speaker series that's organized by the KM Working Group. And the topic today is commercial and DIY air cleaners, effectiveness for reducing harms from wildfire smoke and other considerations. And with us today to give this presentation is a great scholar, Ryan Huff, I should say Dr. Ryan Huff, who is an environmental health and knowledge translation scientist at the National Collaborating Center for Environmental Health, otherwise known as NCCEH. Dr. Huff earned his PhD at the UBC Air Pollution Exposure Laboratory, and that is where his research started to explore the biological effects of air pollution. And right now, his work is really focused specifically on the harms of wildfire smoke exposure and the different interventions that we can use. In the chat at the very top, I have put up the link to Ryan's most recent rapid review for NCCEH, which he's going to be covering today. So you can access that review to get some more details. What we're going to do today is give Ryan a chance to talk for about 45 minutes on the evidence for these interventions, and then we're going to have a group discussion. And what we really want to focus on in that discussion component is what kind of considerations should we address, before we think about using air cleaners and maybe even think about policies like having governments fund those air cleaners for populations to use. So in that discussion session, what we're going to do is just take either questions in the chat or questions by raised hand, and we'll just go based on interest and focus on different topics. So Ryan, with that, I'm going to go ahead and let you start. Thanks for being with us.
Thanks, Stephanie. So today I'm going to, as Stephanie said, going to be talking about commercial and DIY air cleaners and pulling some results from a recent review that I published with the NCCH, and we'll get into some more details of that. But first, I'd also like to, oh, there we go. Just acknowledge that I live in Vancouver, and I'm happy to live, work, and play on the unceded and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh Nations. As Stephanie briefly mentioned, I am part of the NCCEH, or the National Collaborating Center for Environmental Health. It's one of 6 different centers across Canada, and at the NCCEH, we work to identify knowledge gaps, synthesize evidence, and otherwise support environmental public health professionals across Canada. And so a brief overview of what I'm going to be talking about today. I'll do a little bit of background, purpose, and methods that we used for the review. And then the substance of what I'm going to be talking about is a bit about the different technologies that came up, an example study in terms of what kind of details they tended to report, and then going into some considerations and limitations. So a little bit about non-particulate matter pollutants, some information comparing DIY to commercial air cleaners, and then a little bit of detail about the effectiveness of just closing your windows and running portable air cleaners outside, or sorry, inside when it's smoky outside. And then lastly, I'll talk about health outcomes and then give a little summary at the end. So wildfire smoke affects communities across North America. And I always show these pictures at the start of most of my wildfire talks now. I took these pictures myself in 2018 from the Diamond Building at Vancouver General Hospital. And the reason why I like showing these photos is because we often typically think that Vancouver is untouched by um, poor air quality. But as recent events in recent years have shown us, we often have frequent periods of high air pollution due to drifting in wildfire smoke. And we had one episode so far this summer here where everyone probably noticed last week it was pretty bad, but it has been quite a bad year across the country. So this is data pulled from the Canadian Interagency Forest Fire Center, and this is just showing how many different types of fires, whether they're active, held, under controlled, are ongoing in Canada right now. And when you consider the amount of area burned, this has been the second worst fire season on record. So we're over here, and the previous year was 2023. And so over 8 million hectares have burned, which is larger than the province of New Brunswick. So it's quite a substantial amount of land and quite a substantial amount of fire smoke. Now, I'm not going to talk too much about the specific health effects of wildfire smoke. This has been systematically reviewed in a number of different nice reviews, but in general, we know that wildfire smoke causes respiratory effects. It causes respiratory irritation like coughing, production of phlegm, difficulty breathing, wheezing, and then some more serious effects where it can aggravate chronic lung diseases like asthma and increase emergency room visits and hospital admissions. And it can also have serious cardiovascular effects, including heart failure, heart attack, and stroke. So the BC CDC has some really good guidance on how to protect yourself from wildfire smoke. And one of the main things that is suggested is portable air cleaners. And so really this review started by trying to figure out more specifically how effective are these portable air cleaners for wildfire smoke. So in partnership with Health Canada, we performed a rapid review where we looked at the question, what effect does indoor air filtration and air cleaning have on concentrations of air pollutants and human health endpoints during combustion-derived air pollution episodes? And really the purpose of this review was to try and figure out, as I said before, how effective are these portable air cleaners during wildfire smoke events or wildfire-like smoke events, and to synthesize that knowledge and to distill it down into useful information for public health professionals. So this was done with another collaborating center, the National Collaborating Center for Methods and Tools, and specifically with Dr. Sarah Neil Strenko and Robin Trainer, who were very helpful in making this review happen. So before I get into any sort of results on the review, I'd just like to cover some of the definitions that we used when going about the systematic review. So we defined combustion-derived air pollution episode as an unusual episode of air pollution caused by a combustion event, such as a wildland, coal mine fire, peat fire, interface fire. And I'm not going to read the entire list, but the general purpose of this term was to try and encompass all combusted things that can produce a smoke episode. But this does not include the combustion of fossil fuels. So no traffic related air pollution or air pollution related to industrial processes. We defined wildfire air pollution episodes as unusual episodes of air pollution caused by combustion events such as wildland forests, peat fires, interface fires, landscape fires, agricultural fires, and prescribed burns. And lastly, there was another category of papers that were pulled together in this review called haze air pollution episodes. And these would be air pollution episodes caused by a regional uncontrolled forest and peatland fires and open biomass burning that drifted into outlying areas around these events. So air filtration and air cleaning. In our review, referred to passing indoor air through any technology designed to reduce pollutant concentrations. And so this included filters, electrostatic precipitators, sorbent materials like activated charcoal, as well as additive technologies such as ionizers, plasma, ozone, and ozone generators. I'll go into more detail about the specific technologies that were in this review. This is just meant to be an overview of what we were trying to define air filtration and air cleaning is. A lot of the studies we looked at also looked at portable air cleaners. And just to kind of define them, portable air cleaners are portable devices that can reduce levels of air contaminants indoors and are also known as air purifiers. They can come commercially available from many different manufacturers make them. And they are often tested by the Association of Home Appliance Manufacturers, which gives you standardized information about how well they do their job at cleaning the air and for what types of pollutants. But there's also do-it-yourself or DIY portable air cleaners. And these are often built from HVAC filters that are taped to a box fan. And they can actually have quite high efficiency depending on the design, which I'll go into a little bit more later in my presentation. So in terms of the methods for this review, we did a comprehensive search of peer-reviewed literature and manual searches for relevant issues covering the last 20 years. And we screened 6,344 references and ended up with 30 studies. Of this, like I said, we were trying to capture a wide net of combustion-related events to look at the effectiveness of these air cleaners. And so 12 were related to wildfire events, 8 were related to residential wood smoke. So that would be periods where in communities there's a lot of fireplaces running that produce quite a lot of wood smoke in an isolated area. And then you can look to see what the effectiveness of portable air cleaners are in that circumstance. 2 were both wildfire and residential wood smoke. 5 were haze events, and then 3 were laboratory or chamber studies. Now we used 2 tools to appraise the evidence quality. And so the Joanna Briggs Institute critical appraisal tools were used to evaluate individual references. And for specific details on evidence quality ratings, you can find that in the review if you go look on the website for more details. And then the other important thing to note is that we used the grade system or the grading of recommendations, assessment, and development and evaluations to rate the confidence and effect estimates. So this would refer to, for example, how well a portable air cleaner could reduce PM 2.5 concentrations across all references. And with the grade system, you can get a higher grade and a lower grade based on various factors. And so I'm not going to go through all of these, but for instance, if there's problems with the study design, and that can reduce the grade rating, but if there's a large magnitude of effect or maybe a dose response gradient, you can increase your grade gradient. And what this all distills down to is how certain you are of the effect estimate that you are looking at in your review. So what kinds of air filters and technologies were included? In all the studies we pulled, this is a list of the different technologies that were reported on. So there was the high efficiency particulate HEPA filters, which I'm sure most of you are familiar with. And they're defined to remove at least 99.97% of dust, pollen, mold, bacteria, and any airborne particles with a size of 0.3 microns. There was also minimum efficiency reporting value, or MERV, 13 filters. And the MERV is just a rating scale in terms of how effective certain types of filters are. But they are mechanical air filters that remove at least 50% of particles in the 0.3 to 1 micron size range. And to give you an idea, wildfire smoke in particular, the most common particle size tends to be in the ultrafine range. So it tends to be in that smallest category of 0.3 microns or lower. There's also quite a number of studies that looked at sorbent filters. So this, and most, or I think almost all of them, were activated charcoal. There was a couple studies that looked at electrostatic precipitators, and these are devices that can charge particles when they're going through the machine or passing through. And that charge makes the particles attached to oppositely charged plates or other indoor surfaces to remove those particles from the air. And then lastly, there's ionizers, which can generate negative ions that attach to airborne particles and acts to increase how fast they settle on surface or clear from the air. So when you break it down by numbers in our review, the majority of these studies looked at portable air cleaners, so 25 of the 30 studies. And this is a breakdown of the different types. So the most common was a HEPA filter. The second most common was a HEPA filter combined with the activated charcoal filter. And then the most common was a MERV 13 electrostatic filter, of which there was 10 studies. And then 3 of these studies were for DIY packs. And then there was relatively few studies that used some of the fancier technologies like electrostatic precipitation or ionizing. And lastly, there was only a few studies that looked at HVAC, or heating, ventilation, and air conditioning systems, and how filtration worked in those. So the majority of the data coming from this review is from, as I said before, portable air cleaners. So what kinds of pollutants were measured? Because wildfire smoke is not just particulate matter. It is a mix of both gases and particles. And depending on how air cleaners are designed and how they function, they don't necessarily all filter the same things. So in these studies, the majority of them were looking to see how well these devices removed particulate matter. And so 26 of these studies looked at that. And the majority of them looked at PM 2.5. So that's particulate matter under 2.5 microns in diameter. There was a couple studies that looked at volatile organic hydrocarbons. And there was one study that looked at ions and trace elements. So to give you a more specific example, I pulled one study, and the reason why I chose this study is because it's in a public building, and it was really framed with the idea of could you use a portable air cleaner to create a safe space or a clean air shelter during a fire season or a fire event? And this was located in Australia and New South Wales. And what they did in the media room of this library, they put 2 packs, and you can see the details I've listed there. And these were HEPA packs combined with activated charcoal filters. And this study focused on PM 2.5. And the way they defined a wildfire day in this study was that any day that had a mean 24-hour concentration over 20 micrograms per meter cubed counted as a wildfire day when they were looking at to see how effective these packs were. And so if you go down to the results section over here, When looking at the outdoor particle or PM2.5 median, when the packs were on, it was slightly lower, but it had a median of 23.3 micrograms per meter cubed. It was a little higher when the packs were off. But when you look at the indoor concentrations, you can see that when the packs are running, it brought down the median PM2.5 levels to 5.7 micrograms per meter cubed, down from 20. So that was a 72% reduction. And the other important thing to note about this study too is that this library actually did have an HVAC system running. And the filters that it was using were not necessarily at a high enough MERV rating to filter wildfire smoke particles. But when you look to see the combination of what the packs were doing on top of just what the HVAC system was able to do, the packs contributed 40% of the overall reduction of indoor PM2.5 when you're comparing outdoor levels to indoor levels. So now zooming out a bit and looking at some of the overall effects that we found when looking at particulate matter and the effectiveness of air cleaning and air filtration. We found an average percent reduction of 56% across 17 studies. And this equated to an average microgram per meter cubed reduction of 18 micrograms per meter cubed. And that was across 14 reporting studies. And this is where I'm going to bring back the grade rating. So the certainty of these effect estimates is low grade, and that was due to risk of bias, indirectness of evidence, and imprecision. It does not mean that these devices were not effective at reducing PM2.5. It means that we are uncertain of the exact percent reduction. And then of more interest to this crowd, when you look at wildfire studies specifically, and wildfire studies that you could think of as more extreme or heavy smoke events where the PM2.5 outdoors was over 27 microgram per meter cubed. And the reason for that number is because that's the Canadian Air Quality Guideline. And the average indoor percent reduction during these types of events was 66% when you were looking at packs versus no packs, or sorry, air filtration versus no air filtration. And that equated to an average reduction of 19.2 micrograms per meter cubed. So what does that mean in terms of absolute levels? So across these studies, without a pack, the indoor levels were 31.8 micrograms per meter cubed, and with a pack, they were 16 micrograms per meter cubed. And just to note, although there is no indoor standard in Canada for our health-based limit exposure for indoor PM2.5, the World Health Organization guideline for indoor PM2.5 is 15 micrograms per meter cubed. And then looking at another metric of PM2.5, we also examined the indoor-outdoor ratios. So this is the balance of how much PM2.5 is outside versus inside, and then can give you a bit of an idea about the infiltration of PM2.5 in these situations. And so when looking at that metric, the average pre or placebo intervention was 0.69 across 13 studies. And when you run air filtration devices, that brought that number down to 0.37. And then again, with the grading of this effect estimate, it was low grade due to risk of bias, indirectness of evidence, and imprecision. And then, like before, when looking at air filtration and air cleaning indoor-outdoor ratios during wildfires, the average pre or placebo intervention was 0.68. And similarly, it brought it down to 0.34. So not a huge amount of difference in these numbers when looking at overall events and wildfire-specific events. So some considerations and limitations. As I mentioned before when I showed this picture, that wildfire smoke consists of many different things. Air filtration and air cleaners do not filter all pollutants. And packs, especially portable air cleaners, do not replace the need for adequate ventilation indoors. For many indoor situations, ventilation allows for the venting of various gases such as VOCs, radon, carbon monoxide, and carbon dioxide. And when thinking about that, we also examined two studies that looked at volatile organic carbon. And what we found, because of the lack of evidence, there wasn't enough evidence to really make a strong claim about how good air filtration or air cleaning is at removing these types of gases, such as VOCs. But what was interesting is that a test chamber study looking at pine needle smoke and commercial portable air cleaners with HEPA and activated charcoal filters found that some of these devices were able to clean these VOC gases, specifically benzene and toluene, from the air fairly effectively. And so when looking at this graph over here, so this is the VOC clean air delivery rate, where the higher the rate means it's able to clean the air better for these particular substances. And these are the commercial packs here. And then you can see that 4 of them were able to do pretty well. But the point also here is that all of these devices were reported to have activated charcoal filters, which are supposed to be able to filter gases such as VOCs, but 2 were not effective. So just because a portable air cleaner has an activated charcoal filter does not mean they will necessarily be effective at reducing the amount of VOCs indoors. So some other considerations and limitations. So talking about the capacity, I mentioned this in the previous slide about the clean air delivery rate, but just to give you more specific details on the clean air delivery rate, it's how quickly a device can remove particulate matter from the room air compared to a natural or decay state alone. It's often reported in 2 different metrics depending on what country you're in. So either cubic meters per hour, or cubic feet per minute. And AHAM is an organization that does a lot of standardization and verification of commercial portable air cleaners. And when looking for those details, they're always in this type of label, which should be present somewhere on your portable air cleaner. And it tells you 2 different things. So one, it tells you how effective the portable air cleaner is at removing 3 different types of pollutants: tobacco smoke, dust, and pollen. And then it also, based on that, gives you a suggested room size that these air cleaners are effective for. And that's based on 4.8 air changes per hour and standard 8-foot ceilings. When considering the capacity for wildfire smoke, the tobacco smoke number is the one that you should be paying attention to. So some other considerations. What about DIY packs? How good are they against commercial packs? And I'll talk a little bit about that next, over the next couple of slides. But then also in our study, placement varied in homes, offices, and facilities, which likely led to the big range in effect estimates that we saw when we were looking at how well these devices were at removing wildfire-related air pollutants indoors. So, do DIY air cleaners work as well as commercial units for wildfires? I pulled 3 different studies that looked at DIY air cleaners in our review and some of the details related to them. So just you can see the author and then the exposure. So 2 of them were laboratory studies that looked at pine needle smoke, so Stinson and Holder. And then the last one was a study that looked at residential wood smoke. And they reported a couple different metrics that I'll just talk about briefly so you can get a comparison. The first one was looking at the clean air delivery rates. So with the CATRs, remember that the higher number means that it's able to clean the pollutant better or more efficiently. And the HEPA and charcoal commercial packs, the CATRs for particulate matter in this size range, so 0.02 to 0.3, range from 76 to 416, which was not all that different from the DIY box fan versions. And so these are box fans with MERV 13 furnace filters taped to them, as I've shown on the side here. And they were also able to see quite high clean air delivery rates with these devices. The next laboratory study compared a commercial air cleaner against various designs of DIY air cleaners. So this might include taping several MERV 13 filters together in either like a wedge or a box shape to increase the surface area of filtration. And when comparing the CATR values for PM 2.5, you can see that the DIY air cleaners had quite good CATR numbers compared to the commercial air cleaner. And not surprisingly, when you increase the number of filters, it's able to deliver more clean air. The last study, which is kind of looking at more of a real world situation, compared DIY pack use to commercial packs during a wildfire smoke period of time, or sorry, not wildfire, residential wood smoke period of time. And what they found was that when looking at PM 2.5% reduction, the DIY packs reduced indoor PM 2.5 by about 10%, and commercial packs reduced PM 2.5 by 20%. There is some caveats with this study. For instance, not all of the participants necessarily ran the portable air cleaners as long as they were supposed to, according to the study protocols. And they had problems, especially with the DIY packs, of participants reporting that noise was an issue. And so on average, they were running the commercial packs longer than the DIY packs, which may explain some of the differences that you see here in the overall effect reduction. And for more information, Angela Eckelbosch, who used to be at the NCCH, did a really nice review looking at the overall difference between DIY air cleaners and commercial air cleaners. And this was not necessarily related to smoke events or wildfire events specifically. It was capturing more broadly all types of pollutants. And it has great details on the effectiveness, the cost effectiveness, energy efficiency, and noise. And from this review, I pulled up two different tables because it gives you a bit of interesting information about DIY versus commercial units. So the first is that, as I mentioned in the last slide, the inclusion criteria for this review wasn't limited to combustion sources of air pollution. But when looking at these studies, and specifically when comparing commercial designs versus DIY designs, and looking at costs, is that the DIY air cleaners were cost less per clean air delivery rate that they were able to deliver. So they were just as effective looking at the CATR, but they cost less. And then looking at another point, so specifically the noise. And what they found was that DIY air cleaners tended to be a bit noisier than commercial units, but commercial units are also a bit noisy. And so for reference, 50 to 70 decibels is in the range of a quiet to loud conversation. But this is known to be an issue in learning environments like classrooms. If you're interested in more resources on DIY air cleaners, I pulled three different resources. So one, again, is the NCCH review that I was talking about. Another is if you go to the BC CDC website, they have great information on wildfire smoke preparedness. And in particular, they have an infographic about how to build your own do-it-yourself air cleaner. And then also the BC Lung Foundation and has a great website looking at how to build DIY air cleaners and how to use them. So what about windows? Um, Health Canada recommends closing windows and doors as much as possible during wildfire episodes. And in our review, 2 studies examined window and portable air cleaner conditions, specifically in an apartment tower during a heavy haze episode. And so this would have been an apartment in, I believe these apartment towers were over 20 stories, and they would have been a mid-floor apartment, and they were looking specifically at how well PAC could reduce indoor pollution in a bedroom. And so just to give you an idea of how bad the PM 2.5 was in these studies, the range for all the different conditions was 37 to 157 micrograms per meter cubed. And then when you look at the data from this, I put this together into 2 different tables. So the first study, Tran et al., had 3 different conditions. They had window open, window closed plus air conditioning, and then window closed plus portable air cleaner. And looking at the amount of indoor PM 2.5, it dropped from 48 down to 26 when you closed the windows. And then when you had the windows closed and had the PAC running, it was 15 micrograms per meter cubed. So this resulted in a 69% reduction in PM 2.5. When looking at the other study, you can see when the windows were open, the levels were 71 micrograms per meter cubed. When the windows were closed, the levels were actually increased, but this is not a surprise since during this condition, the outdoor conditions were quite severe at 157 micrograms per meter cubed versus 94 when the windows were open. And then when the windows are closed plus the portable air cleaner running, that dropped levels down to 23 micrograms per meter cubed. And so that led to a very similar overall reduction in 68%. So what this generally is showing is that sometimes closing your windows can be effective at reducing PM 2.5. But really the main point of this is that you can get quite good effectiveness in running a portable air cleaners when you close your windows during smoke episodes. So what about air filtration and health outcomes? More studies are needed to really determine the effect of portable air cleaners on health outcomes during smoke episodes. We really did not find, we really did not find that many studies that looked at this. There was 4 in total that looked at various health outcomes, and only one was a wildfire study. And it's important to note that none of the studies reported on the use of emergency services, emergency room visits, hospitalizations as outcomes. And really that led us to the conclusion that it's uncertain if air filtration improves cellular level health outcomes or improves self-reported physical health outcomes during combustion-derived air pollution episodes. And really, that doesn't mean that air filtration isn't helpful. It just means we didn't have enough information to make a good determination on that question. And when we look at specifically at some of the things that we found, when focusing at the cellular level, at markers of systemic inflammation and impaired endothelial function, they were positively impacted or improved by HEPA filtration use in one study. But in the other study that looked at this, they reported no effect. And then when looking at self-report outcomes, so this would be things like asthma symptoms or physical, mental, or all-cause symptoms. There was one quasi-experimental study and one RCT, but they reported no effect. So based on that fact, I don't want to leave you with the impression that air filtration isn't important. Because exposure to ambient air pollution or particulate matter is well known to be associated with a broad range of acute and chronic health outcomes. And Health Canada specifically has no health-based limit for exposure to indoor concentrations of PM 2.5, as in the lower the better. And when looking at a recent study by Eric Coker and Sarah Henderson, they were looking at what low dose exposure to outdoor PM 2.5 does across 13 wildfire seasons, and specifically looking at all-cause mortality. And they found significant associations between PM 2.5 in the 12 to 14 microgram range, which is important to note because it doesn't take a lot of PM 2.5 to necessarily affect our health when looking at a broad population level. It's kind of well known. And so really trying to use these devices to lower your overall exposure is likely very useful, but just what that overall effect is going to be and on what outcomes is a bit uncertain at the moment. And then lastly, the other point that was interesting in this paper too is that they were looking at the combination between PM 2.5 exposures and heat, and they found that mortality was quite significantly affected by the combination of wildfire smoke PM ambient air pollution and heat temperatures over 26 degrees. And so with that, I'll leave you with an overall summary. So when looking at air filtration and air cleaning effectiveness, during combustion-derived air pollution episodes, air filtration devices do reduce indoor PM 2.5. And during these types of events, they were able to reduce PM 2.5 by 66%. And the range for that was 34 to 99%. And these were specific to wildfire events. And that led to an overall average reduction of 16 micrograms per meter cubed. More studies are needed, as I was just discussing, to understand the effect of air filtering on other components of or non-PM components of combustion pollution. They may be effective at filtering VOCs when activated charcoal filters are present, but there's no standardized way of determining that yet. And we know that other types of gases are known lung irritants and have their own health effects that are present in wildfire smoke. Using packs with windows closed can be an effective strategy to reduce indoor exposure. And DIY air cleaners can be just as effective as commercial filters when built well. Finally, when looking at air filtration and air cleaning on health outcomes, more studies are really needed to understand what the effect of air filtration is during these combustion-derived air pollution episodes, and really trying to look at what that means. I'll leave you with one other thing. Some other resources of interest you might be curious about that I have put out this summer. So one was another rapid review looking at the effect of wearing a mask or a respirator during combustion-derived air pollution episodes and what effect that has on human health endpoints. And that's available from the NCCH website with just a QR code there for you to be able to access. And then the other one was a blog piece looking at deploying portable air cleaners in childcare settings. So this would be in schools or childcare facilities. and really what kind of things to look for when choosing your packs and what kind of considerations that you should think about uh, when deploying these devices during these events. And with that, I will say thank you for listening to my spiel about this topic, and I will turn it back to Stephanie to open it up for discussion.
So we talked about a lot of things today. We heard about the quality of the evidence and a lot of different considerations. I want to thank Ryan again for being with us and know that we see that these evidence reviews involve a ton of work. You're obviously more patient and diligent than I am. So thank you again. And please do join us for our next Lungs on Fire speaker series, which will be Angela Yao. You will all have that invite in your calendar. So with that, I'm going to press stop on the recording and thank you also to everybody who has joined us online.